Let's talk about a peripheral iridotomy. This is the laser that pokes a tiny little hole in the iris, the colored part of the eye, to lower the risk of a condition called angle closure for people who have been told that you have narrow angles. So what is a narrow angle? Inside of the eyeball, part of the eye makes fluid all the time, like a faucet that's turned on. Part of the eye drains that fluid. And so this procedure is for people where that drain is really crowded. The drain's not closed, because if that drain closed, then your eye pressure would go really high really quick. And that causes a weird headache, nausea, blurry vision, which is an emergency if those all happen at the same time in somebody with a narrow angle. But by doing this laser, we're significantly lowering the risk of that condition, which could blind you if it's not treated in a timely manner. So what we're doing is poking a tiny hole in that iris, the colored part of the eye. This is a procedure where you can feel something. Most people feel like a little flick, like a rubber band's kind of flicking them. It's very tolerable. The procedure takes about 30 seconds to a minute. There is a risk of some bleeding, which is usually very minimal. It can make things blurry the first few days, but it's pretty unusual to have any problems with the bleeding. Any procedure carries a risk that the eye pressure can jump up, so we always check your pressure afterwards. There's some eye drops that you use, and there's no restrictions on activities after this procedure. But this is a procedure not to help you see better, but just to lower the risk of going into that angle closure condition I was talking about. For patients who aren't near cataract surgery, if you're anywhere near cataract surgery where the cataracts are causing symptoms, then cataract surgery happens to pretty much eliminate that angle closure condition. Doesn't mean you can't have glaucoma or eye pressure problems, but that's actually a more complete treatment. But when we're not there yet, this peripheral iridotomy is a way to significantly lower the risk of that angle closure condition by doing something in the office that's low risk and low invasiveness and covered by insurance and relatively easy to tolerate. So great option. Happy to answer further questions on this if you have them.